Good afternoon, good morning, good day to all. This presentation, titled Bench to Bedside Research, the case for increased involvement of pharmacists in translational research, is being delivered by me at a scheduled program, Pharmaceutical Society of Nigeria Young Pharmacists Group Research Hub, Maiden Virtual Induction Ceremony. The thematic areas of interest in this presentation will revolve around what translational research is, the bench to bedside, what it talks about, the field to policy practice, and the pharmacist's role. Translational research as a form of introduction and within the context of this presentation, translational research is an important aspect in biomedical research. It is important to note that it is the process that focuses on translating basic scientific discoveries into real-time clinical applications and ultimately to public health improvements. Biomedical research translation continuum is a new term which replaces the term translational research, which defines the translation process and describes the progression of knowledge from laboratory to health gains. It is important to note that what happens at the laboratory on the bench is being escalated or scaled up to reflect in real time at the bedside in clinical sites. That diagram on the slide is showing what we do at the bench in the laboratory when we finish establishing the safety and prospects of its usefulness. We now take it up, scale it to clinical site in form of clinical trial with appropriate ethical approvals for use to improve outcomes in patients. And bench to bedside within the context of this presentation simply refers to the process by which the results of research done in the laboratory at the bench are directly used to develop new ways to treat patients. It involves taking research results from the laboratory into the clinic so that it can directly benefit patients. In its simplest form, conducting this sort of translational research involves first conducting basic experiments in the laboratory or at the bench. Then secondly, preclinical research is conducted in animal models to establish safety and efficacy. Then third, clinical studies in humans help to move a research concept to the bedside. The diagram is clearly showing the flow of the basic science from the bench, how it passes through clinical research, clinical practice, and precision medicine for applied science. Field operational research to policy and practice. It's not every concept of research that is done that has to be in the bench or in the laboratory. Indeed, there are some field and operational researches which the outcomes based on empirical evidence can also impact on policy and practice. So the goal of operational research is to increase the efficacy, effectiveness, and quality of services delivered by providers and the availability, accessibility, and acceptability of such services desired by users. The obstacles that prevent the translation of field or operational basic research into policy or practice are many and complex, but it is important to state that these barriers can be summarized into two basic categories. First is the individual researcher characteristics, and the second is the systems or organizational, institutional factors. The basic research focuses on an individual, then as depicted on the diagram to the right, it shows that there is routinely collected data can be used. Then research under controlled conditions are also monitored. Then maybe only researcher may be involved. Then deals generally with health issues that inform such operational research to find what is the prevailing problem and how it can be best resolved, then not implemented to practice. Then what in all this conversation of translational research, both either the bench or laboratory research or the operational research, what are the role of pharmacists in this? As researchers, pharmacists are exposed, or rather uh, practice their activity in clinical pharmacy, pharmaceutical care service delivery, in drug therapy problems identification and resolutions. Pharmacists have role to play in supply chain and logistics management, the entire gamut of procurement and vendor supply management. Pharmacists have role to play in public health, health-seeking patterns of citizens and specific populations. Pharmacists indeed have role to play in pharmaceutical quality systems of products and regulated items. Then pharmacists indeed have role to play in drug development and drug production management. Other areas that pharmacists have role to play within the context of this presentation include drug utilization researches, in the sense that what are the uptake, what happens when drugs are consumed, drug misuse, and also rehabilitation programs, how populations misuse and abuse drugs and what can be done to remedy it. Another important aspect based on the One Health program is the drug waste management perspective. That aspect is also lying fallow, and is a low-hanging fruit that pharmacists need to wake up to their responsibility to know what happens to unused medicines, expired medicines, and wasted medicines. The case for increased role of pharmacists in translational research. It is important to focus that as an icebreaker, the starting point is usually for any meaningful translational research, it must start with asking the right questions that will spur the interest to resolve problems and impact on improving health and well-being of patients. The time frame. No exact timeline for bench to bedside, but in most studies and in most protocols, it lasts between 10 to 15 years. Several years of work in research labs followed by development of preclinical models. Then years for human clinical trials designed, approved, and funded. To establish proof of concept or principle, opening the door to several additional phase 2 and 3 trials before final adoption for routine clinical practice. Cases where the time from bench to bedside is shorter are in compassionate studies of investigational drugs conducted in patients. Safety and efficacy is being weighed and looked at versus rapid progression of the disease condition. A case in reference is the need for a vaccine during the COVID-19 pandemic. The diagram on the right side depicts from bench to bedside, where you have the concept planning to validation of the protocols and the models that want to be used, then upscaled to manufacturing and production of the investigative product for clinical trials. Challenges of bench to bedside research. It is important to note that the bench to bedside research, even though it's the way to go, because it has clear focus and clear objectives, pharmacist researchers encounter a variety of obstacles on the path from taking a novel concept from the bench to the clinic. The first challenge is determining and asking the right questions at the bench level that have clinical relevance. So in essence, the individual researcher needs to focus on knowing the key concepts, the key issues why he's trying to delve into an research endeavor that will impact on clinical practice. The second challenge is inadequate funding. Partnership between research groups from universities, research institutes, pharmaceutical companies, and non-governmental organizations as funders is key until this tripartite arrangement, or in some other cases, it could be quadruple model, either the triple model or quadruple model is important. What makes it quadruple is to add the community instead of only the researcher, the pharmaceutical company, and government. The third challenge is getting the new drug onto the essential drug list, and it's important its acceptance into hospital formularies for routine prescriptions by the physicians and usage. But this is linked to once it meets conformity and it is approved by the regulatory agency, in this case Nigeria, NAFDAC. Important way forward in this conversation is there is the need for sustained collaboration and networking between researchers and clinicians. Pharmacists enthusiasts in research should seek for mentorship from researchers that are involved in real translational research projects. Thirdly, as a way forward, dismantling of silos and establishment of synergy, a handshake between bench researchers and clinicians is key. Clinicians should have that collaborative nature to welcome bench researchers into their meetings and also engagements, so that they know their problems and there will be that handshake to know how models of researches can be developed to solve the problem clinicians face in clinic. Successful translational research projects should facilitate cross-fertilization of ideas and discourse between the researchers and the clinicians. Lastly, a way forward is embracing the triple and quadruple helix model for sustainable collaboration and partnerships between academia, government agencies, and industry, and indeed the community. The community is the reservoir that provides the volunteers that consent to informed consent to participate in utilization of drugs and products that are needed for validation. The simple diagram on the left shows that the quadruple helix model speaks to the relationship between citizens, academia, government agencies, and also the industry. As a way of conclusion, for pharmacists to remain relevant and hold on to our status as cornerstone in the healthcare ecosystem, there is the compelling need to deliberately adhere and operationalize the tenets of the 9-star pharmacists. Through continuous improvement of competencies and skills to be innovative at all times in solving the myriads of drug therapy as well as drug-related problems bedeviling the healthcare sector in Nigeria, with the application of translational evidence-based research. The ball is in the court of young pharmacists and indeed all pharmacists with research interests to salvage and advance the essence of the noble pharmacy profession in Nigeria. Thank you for listening and God bless. Take out time to like the presentation, subscribe to the YouTube channel, and also pass your comments for improvement and also any other thing we need to know. Thank you and God bless.